Hi, I'm Rachel Wall, founder of Inspired Hygiene, and I'd like to talk to you today about harvesting the seeds you've planted. So we all do this as clinicians, right? As sometimes we'll talk to patients and we'll say, well, today I planted the seed. I let this patient know that if the next time they come in and their gums are still bleeding or, this cavity is still here, that we're gonna have to do something about it, right? And so there are a couple different ways that this can go. Sometimes we're planting a seed when maybe we should have recommended the treatment right away. And sometimes we're planting a seed, but we never harvest. We never come to the time where we move forward with whatever our recommendation is, right? Is maybe we say, well, we're gonna harvest this tiny little piece of the crop. We're gonna say, maybe we're gonna bring you in more frequently and see if that reduces the bleeding. And then the next time, okay, I'm gonna recommend that you floss more and see if that reduces this issue. So what we're doing though sometimes is we're planting seeds over and over, but we're never harvesting. We're never getting that crop, and the patient's not benefiting from that harvest, right? They're just hearing that same message over and over, but they don't value any movement forward because we haven't recommended that. So for example, in the case of periotherapy, right? What we know is that sometimes we're planting seeds because the patient doesn't seem to be getting any worse, right? Their inflammation, their level of bleeding doesn't seem to be changing much. It doesn't seem to be getting worse, but here's the thing. Just because it's not getting any worse doesn't mean it's getting any better. And most of the time, when it's staying stable like that, what that means is that patient is walking around with chronic inflammation and a very heavy inflammatory burden, right? And couple that with their high blood pressure, their diabetes, their obesity, their stress and depression, things like that that we see all the time in our patients, and it's putting them at a high risk for heart attack, stroke, and type 2 diabetes according to numerous studies. All right, let's think about this from a restorative standpoint. Right, when we're planting that seed that, hey, the next time you come in, it's gonna be time for you to replace this old amalgam with a crown. Well, what if we recommended that today? Or what if we planted the seed and then we harvest it pretty quickly, right? Maybe the next time they come in for their perio maintenance, because what happens is even if that old amalgam doesn't look on the surface like it's getting any worse, we have no idea what's happening underneath. And what if that patient just bites just right on that tooth and then all of a sudden that tooth breaks down into the root, gone, right? So what I would challenge you to do is, with all of your patients today, look at the seeds that you've planted and ask yourself, is it time to harvest? Thank you. Until next time, stay inspired.